Hello everyone, Earl Henderson, Primordial Defense. Thank you for watching. Today's video is going to be about pediatric medical care and preparedness. I have a special guest today for this video. Everyone, please welcome Mr. Jack Henderson. So when we talk about medical care and preparedness, traditionally that's always going to be from the adult mindset. If you go do an internet search for trauma kits, blowout kits, IFAC, stuff like that, all this stuff is going to be geared around adults. And all my stuff has been, for the longest time, centered around adults. All my gear, up until now, has been centered around having to deal with an adult. Whether it's for me, my spouse, or at work, my teammates. Now, can some of this adult stuff be used on children? Yes. However, not all of it is compatible. You do need some specialized pieces of equipment to deal with small children. And that's what we're going to be talking about today. So, when he came in to my life, I now had a very intense interest in getting specialized equipment for him and creating his own IFAC, so to speak. Now, normally IFACs will traditionally come in something like this, right? Something about this size. And that seems to do pretty well. You can fit some of the more basic stuff in there. For his kit, I wanted the basic stuff in there plus a couple extra things. And I needed a larger container for that. I had initially thought about just getting basically a very, very small backpack, something like a travel bag, something you would expect to take on an airplane or something like that. And I thought that would do good. I also thought about some type of sling pack variation. Thought that would do good. And then I remembered several years ago, I used to use an old school Alice butt pack for my medical bag carrier kind of thing. And I was able to actually stick a neck brace in there, put my med bag in there, and it carried all the stuff I needed on that waist pack and be out in the field with it, pull it out, and get it to work. So I thought, all right, I could get something like that, and I started looking on Amazon for butt packs, and I found some butt packs on there, and then I also found some interesting underwear with butt padding on it, and I kind of wondered why that was showing up in the search results. But a friend of mine had a butt pack, or a waist pack as it's called. It's called the Molly 2 Modular Lightweight Load Carrying Equipment Waist Pack. He's getting out of the Army, and this is stuff that he doesn't have to turn back in. It's already been written off. So he gifted this to me, and it fits my needs now. I can fit the extra stuff in there that I want and still carry the basic quintessential blowout kit kind of stuff. So first off, we'll start with the car seat itself and what I've done to the car seat as far as preparedness. With the car seat, I've added a Rescue Me tool. This is so that I can cut the seat belt or cut the webbing strap that keeps the car seat attached to the vehicle in the event of an emergency. If there was a car wreck or something like that, the best place for the baby to be or be kept in is the car seat. The car seat itself becomes their spine board in a sense. It is the preferred thing to keep them in for spinal immobilization. You don't want to, after a car wreck, take your baby out of the car seat because they could have some type of spinal injury, and by you taking them out of the car seat, that could be bad for them. Medics can come there, get them, transport them just to where they are, get them to the hospital, and actually put them through x-ray while they're still in the car seat and make sure nothing's bad and get them out. So this isn't for cutting the little straps that keep them strapped in, although they could, because this is just basically smaller seatbelt material. It would cut through it quite easily. It's not for that. It's to cut through that little strap that keeps this thing attached to the vehicle. Now, this car seat is a, I forget the terminology for it. Let's see here, it says right here, Click Connect. I guess that's the terminology for it. So there's like a base plate that stays in the vehicle, and then this car seat will lock into it. And then there's a little lever thing on the back, and pull it, and it disengages the locking mechanism, and you can take the car seat out, and the base station stays in the vehicle. So I put this on the car seat itself. That way, whenever the grandparents want them, they have a base station as well, so they can click his car seat into it, and this thing will always go with him. Now, it does have, what's the matter? Here. You're getting a little cranky. Where was I at? So it does have the locking mechanism in the back that you just pull up on and take the seat out. So that should be able to work. However, I put this in there for in the event that somehow that breaks, like that doesn't work anymore for whatever reason. That could be the vehicle has been compacted enough to where the passenger seat is now pressed so far into this thing and pushing it back that you can't get it to unlock. And so this would be used to be able to reach up under the seat and just cut through the webbing that's keeping the whole thing attached to the vehicle. It also has a glass breaker on there so that in the event of an accident does occur and trapped inside the vehicle, we know that this is going to be attached to the car seat, so we can just crawl into the back if able to, or reach into the back, grab this, unhook it, and then snap or break window, and then be able to get out of the vehicle that way. So on this car seat is this little rescue me tool, and I've got it zip tied off to the side, and he's not going to be able to reach it. Now, when he gets a little bit older and he's larger and he's able to mess with it, I might have to look at potentially moving this somewhere else, or at least always keeping the handle back and having this kind of recessed back there. That would be harder to kind of reach behind it and get this thing out. I could always drill a hole into the little plastic right here. There's a little overhang lip, and drilling a hole would not alter the structural integrity any, and then I could be able to hang it there and then completely reduce any chances of him reaching and grabbing it. And even if he did reach and grab it and pull it loose, it's not like he can hurt himself because this cutting tool is recessed inside of itself. But it could become a choking hazard, or he could just pitch it out the window. But yeah, the Rescue Me tool stays attached to the car seat itself. Now, the rest of this gear stuff. So, tourniquets. A standard cat tourniquet or soft tourniquet is not going to work for an infant or even a toddler. It's just not going to be able to work correctly on them. An elastic style tourniquet, such as this TK4 tourniquet, would be the more preferred style of tourniquet, or a SWAT T. Is it SWAT T? I think it's called SWAT T. It's like an oversized rubber band in a way. It's like an oversized IV tourniquet. You know, those thin blue tourniquets that the nurses will wrap around your arm when they're going to draw blood. It's like an oversized one of those. Or a rat's tourniquet would suffice to work on smaller patients. The windlass ones, they're just not going to work. So I haven't bothered putting a cat tourniquet in here. I will eventually add a cat tourniquet in here when he gets way older, and the cat tourniquet would then be useful. But until then, I have a TK4 tourniquet in here to be able to stop any type of arterial bleeding, and that it's like one big elastic band that you can get a good tight wrap on and stop the blood flow. And here's a pictogram on the front of it. So I've got that. Got some H&H compressed gauze. So it looks like it's a huge package, but it's really not. It's just a thin H bandage in here. And they also make another one of these. It's called a mini bandage. And I'm going to end up getting one of those as well. But this would be for using on him because it's a lot smaller. Of course, you know, could I get a big Israeli bandage or, you know, something like that? Yeah, but it's going to be kind of overkill. It's going to be really huge. So something like this would be able to be used for someone with smaller limbs, and for him this would be very workable. Of course, I'm going to add some more some stretch gauze and bandage and stuff in there. As far as airway stuff goes, I've already got some of these things and another kit, but I wanted to go ahead and just have his own standalone kit with stuff in it versus me robbing stuff out of my other gear. So I went ahead and ordered a pack of oral airway adjuncts, and this is going to be for his kit. So you can see, starting off, you have the little infant-sized oral airway, and it goes all the way up to, as you can see here, a large adult size. And so this is going to stay in his bag, and as he grows and gets larger, then all these different sizes will be usable for him. I'm not going to separate them out and put just the infant one in there and then worry about trying to throw the other ones in there as he gets older. I'm just going to keep the whole bag in there. That way, as he gets older, it's all there. Plus, also, you know, if we're at a playground or something like that and some other little kid gets hurt or something like that, or we're out somewhere else, then we have this stuff to be able to use as well. So sometimes he likes the passy, sometimes he don't. Yeah. So I also went ahead and got a package of MPAs with different sizes in here. And again, I'm not going to keep them in the cardboard box. I'm going to put them in a Ziploc bag, kind of, you know, save room. The same thing with this. I'm going to keep all the sizes in there. Actually, I might take one of the adult sizes out and put it in my gear, because I've got one piece of equipment that is kind of aging, and I'm kind of questioning the MPA that's in it. As far as tape goes, I'm a big fan of duct tape, and I've got this flat laying duct tape that I got from galls.com. I think you can find this from other places. All it says is flat duct tape. I don't know if who the manufacturer on it is, but you can find this stuff anywhere. And if you can't find it, you can make something like this on your own. Just take one of those junk letters you get for a credit card advertisement. It has a fake credit card in it. Just take it and wrap a bunch of duct tape around it, and you can get something about this thick or maybe about that thick, and then still have a bunch of duct tape just in a smaller package. Because once you get that big roll of duct tape, like it takes up a lot of room. Oh, what's the matter, buddy? Huh? What's the matter? So EMT shears for being able to cut clothing and stuff off. I don't see the need to go all out with the big, you know, like the Leatherman thing, what are they called, Raptors or whatever, like the big heavy duty, like use them a million times and never break kind of shears. These are just the regular run-of-the-mill disposable shears that you can get, and these will be just fine for being able to cut clothing off. Depending on what clothing he's got on, like he's got these little pants on, and you know, you can just tug these pants off. Onesies, you know, yeah, you could very easily just take the onesies off. It's very thin material. It's not like you're going to have to cut through stuff all the time. But it's always good to have shears in your medical kit to be able to take clothing off, especially if you can't get them to roll around, especially if you have something like maybe a possible spinal injury or something, and you don't want to risk pulling the top over their head and their head moving. You could very easily just take this and cut along the clothing and take it off that way. The biggest thing though is it having a blunt tip on there, and that's why these type of shears are preferred, because you can't stab yourself with them or stab the patient with them. They're blunt tip. One of the other things, one of the main reasons why I wanted a larger bag was to be able to carry something additional. So traditionally, something like a bag valve mask is not something that you would keep in an IFAC or something like that. It's kind of bulky. But I did want to have a bag valve mask just for him. That way, if we're all the way out in the country somewhere, ambulance response time is going to be pretty lengthy. I've got at least some stuff that is going to make a better chance for survival. And so this is just a pediatric bag valve mask. It's similar to the adult, it's just a lot smaller. And this right here is smaller so that when you inflate, you don't blow their lungs out. Because if you took an adult bag valve mask and squeezed the whole thing, I think that would be causing some damage to the patient. And of course it has this super little tiny face shield to be able to put over their mouth and nose. And then I've got a C-collar that he is not having fun doing this video. So it goes from infant, well, the sizing on, I'm sorry, I'm out of view. So it says infant, pedi, petite. So there's a few different sizings on there, but it's a C-collar to be able to put around his neck in the event that I suspect he has some type of spinal injury. Again, like I said, if we're in the car and we're in a car wreck or something like that, the best thing is just to keep him in the car seat. The car seat will be his quote-unquote spine board. But if we're out somewhere else at the playground, you know, he goes a little over the top and decides to climb a little bit higher on something, falls, then I've got, you know, C-collar there. Or out somewhere and someone got a hold of him and they, you know, trip and fall over a toy or trip and fall over something and they go down, then at least put this around his neck to keep his C-spine stabilized. And then from there, put him on something like a clipboard or something like that to maintain spine immobilization. So that's the trauma stuff. Now, there's a difference between trauma gear and a boo-boo kit. And a boo-boo kit is going to be something that just has band-aids in it. And I think it's important to note that there is a huge difference between a boo-boo kit and a trauma kit. A boo-boo kit is not going to control severe bleeding. Like this little band-aid is not going to stop a large puncture wound or something like that. That compressed gauze and this mini bandage is what's going to be needed to stop severe bleeding. So there is a difference between a boo-boo kit and a trauma kit. And I have a boo-boo kit here with little small band-aids and stuff in it and some other little things in there to be able to address the little things. That way we're not, you know, opening this thing up for a little scratch, because that would be a waste of product and a waste of money. And we just fed him too, so I don't think he's hungry, but he could be wanting some seconds because he's a growing boy. Yeah. So this is a kit that I have not fully built out yet. I will be building some more stuff into it. I'll be adding a light in there for nighttime stuff, getting a headlamp in there, because I do think that headlamps are a great addition to trauma kits. That way, if it's at nighttime, you can be able to operate hands-free with the headlamp and still be able to see what's going on. And then I'll be adding a couple extra little things in there as well. I just haven't got them out yet. One thing I might start including is something from this box, which I haven't done the video over this box and this other bag yet. But there's some stuff out of here that I'll be adding into it. But I just haven't got to that point yet. We'll go ahead and get him out of here. Come here, buddy. Come here. So that's the pediatric trauma bag that I have getting set up for him. Having the gear is just one part of the solution. The training is the other part of the solution. So if you're going to be getting this kind of stuff, you need to get training in how to use it. Now, with that being said, just because you don't have training in it doesn't mean you can't get this stuff. You can still get this stuff and keep it in the car. And if you're out and about and something happens, then, you know, there's the possibility that there could be like an off-duty nurse or an off-duty doctor or a medic or something like that who could, you know, want to come up and help. And they don't have any equipment of their own, but you got this bag of stuff in it. And now you just made your life and your baby's life and their life a whole lot easier by having all this stuff. But training is something you need to go get. Now, being a certified EMT, of course, you know, I've got the training behind on dealing with pediatric emergencies and stuff like that. I don't have the experience dealing with pediatrics. I guess you could say that I've been fortunate not to have to go to a scene of an accident with an infant or anything like that. I have dealt with injuries with small children, like kindergarten age. I have dealt with those kind of injuries, but, you know, any smaller than that, I don't have that much experience in it. But I do have, you know, the training in it. There are, aside from obviously, you know, going through EMT classes, which can be expensive and pretty lengthy, there are some basic CPR, AED, first aid classes that you can go through to get some knowledge and hands-on training in dealing with how to give CPR to a baby, how to do first aid to a baby, stuff like that. And that's something I would highly recommend that people go do, because it is a good wealth of information. Of course, you can, and I don't always advocate, you know, looking at videos online for training, but you can look at some videos online and get an idea about, you know, some things that you need to do. But that should never be a substitute for real actual training. You should go sign up through either American Heart or Red Cross or something like that and get an actual class under your belt. That way you'd be better prepared. When we talk about medical preparedness, you know, ambulance response times can be maybe 7 minutes or longer. And that's a long time to wait to get some type of pre-hospital care for your loved one. When we talk about pre-hospital care, there's a couple of terms that are used. One is called the Platinum 10, and the other is called the Golden Hour. And these are references to time. So the Platinum 10 is the first 10 minutes. So the first 10 minutes that you can provide pre-hospital care to a patient, you can increase their chances of survival by X amount %. Now, I don't remember what those statistics are off the top of my head, but within the first 10 minutes of rapid intervention, you can increase someone's chances of survival by a lot. The golden hour, if you can provide medical care and get them to a hospital within an hour, again, you can increase their chances of survival by X amount of %. So this is what this is. This is increasing chances of survival in the event of an emergency. Because it takes too long for an ambulance to get there. Even your best ambulance company with all the accreditations and everything, there's still going to be a response time. All right, it's not Star Trek. They can't beam right there in an instant or anything like that. It's going to take them a few minutes to get there. And if you are out in the country somewhere, it is going to take a considerable amount of time for a responder to get there. I mean, it could be longer than 10 minutes, depending on, you know, where you're at
And if it's going to take them, 15 minutes to get there, well, that's a 15-minute ride back to the hospital. And there's only so much that the paramedics can do in the back of that truck. Even if you have, a volunteer fire department within the area that you live, just because you have a volunteer fire department does not mean that you're going to have anyone there who is an EMT or medical responder that's in the district for that day. I've heard many times before in the past, listening to the radio, you hear an ambulance get dispatched out to somewhere out in the county, and the tones drop on the radio, and they call out, the nature of the emergency and the address and everything, and then it's crickets. You don't hear anybody talking, and you hear dispatch, say it again, and then someone from that district gets on the radio because they took their radio to work with them, and they'll get on there and they'll tell dispatch, advise Medcom, we may not have anybody in the area. And that's a reality, especially when you're dealing with volunteer fire departments. Those people have regular time jobs that they have to go to, and sometimes there's a lapse of coverage. They're not able to get to a scene because they don't have anybody there to do it. And also because they don't have a whole lot of people who are trained in medical stuff. You take, 12 people on a roster at a fire department. Not all 12 of those people are going to be EMT certified. There may be one or two that are EMT certified. It's just an expensive thing to go through, and there's been so many agencies that have been burnt when they send people through EMT school, and then that person, once they get their EMT license, they're like, well, I don't need to play around with the volunteer fire department anymore. I'm going to go work for the ambulance company, and then they'll leave them. So a lot of volunteer fire departments don't initially pay for EMT training anymore. They expect the person who wants to be an EMT to go pay for that class themselves, and then they can get reimbursed. So even, like I said, even if you have a volunteer fire department in your district and they've been pretty decent with responding to other calls, house fires and accidents, stuff like that, doesn't mean that there'll be any trained EMTs able to come out and do anything. So you literally could be waiting 15-20 minutes for an ambulance to get out there to you. That's a long time to be waiting for someone with medical equipment and the knowledge on how to use that equipment to get to you. Now, your dispatcher may be emergency medical dispatcher trained and be able to provide instruction over the phone, like how to do Heimlich maneuver, how to do CPR, stuff like that. But if that's your first time, having to do anything like that, and you've never had any experience in doing it, and it's your own loved one who is hurt, you're going to have a lot of adrenaline pumping, and you may not be able to follow directions very well. So it's best to get this training on your own. You have to be responsible for you and your own. You cannot 100% fully rely on other people to come save you. You have to be able to do it yourself. If you're watching this channel, chances are you probably have some type of involvement with guns, most likely, and concealed carry, security, police, whatever. If you are having the mindset that you're going to carry a gun because it takes too long for a police officer to respond to you, then you should also have that same kind of mindset when it comes to medical care. You should be thinking it's going to take too long for an ambulance to get to you. You need to get that equipment, and you need to get some of that basic foundational knowledge on how to use that stuff. Simple BLS care, basic life support care, just the basic of the basic, saves a lot of lives. Yeah, ALS, advanced life support, does really good in certain situations and saving people's lives. But even your best paramedics will tell you that your very simple BLS techniques, interventions will solve a lot of your problems. And you can get that in a good CPR first aid class. And that could make the difference between your loved one surviving and your loved one dying. That's about it on what I want to talk about. If you like what you hear and see, go ahead and give me a like and a share. If you haven't already, hit that subscribe button and stay tuned for more videos. Earl Henderson, Primordial Defense, thank you for watching.